Navigating communication with different cultural groups can be challenging. Advice and suggestions on how to communicate and connect more successfully has been gathered from experts in the field and members of the Aboriginal community to help you to develop cultural awareness and understanding.
I guess for me is come with an open heart, come with an open ear to listen, be ready to really try and give it a go and connect with people and connect with people as a friend. I would say there's lots of rules we get told about communication. They're fine to be aware of, but not to let that fear of the rule block you. Sit with a person, their friend, and have a yarn.
If you're talking about relationships with people, then being inclusive is so important. It's part of people feeling better. I can see you're working for me, that's why you're all talking. But that's just a small thing to turn to the patient and say, we are standing at the end of your bed having this talk about you, so we know how best to look after you. And a small thing like that can totally change the dynamic for someone, and they can sit back and relax knowing that you're working for them.
You're not expected to understand that culture, but you are expected to be respectful and to listen and to try to accommodate that culture within what you're trying to achieve, which is to make them better. But if you go off on a solo trip of treating the disease and not the patient, then you're never going to succeed, because you need the patient to cooperate. You need them to be on that journey with you. And you can only do that if they trust and respect you. And that's a two-way street.
Aboriginal health is all about relationships. It's important to find out where they're from because they then think you're talking about them as a person rather than them as a patient, and that's a very important thing from their point of view. And because their connection with their country is so important, it's important for you to actually understand it from their point of view. And when you ask them, they actually realise that you understand them.
With communication levels even as good as they are today, it's still the psychological side of it that you can't put pen to paper with. So I know we come from two different worlds, and my belief is that we have our ways as an Aboriginal, we have our ways of dealing with these issues, but some issues that we can't, and we have to seek outside advice. And it's all about the listening and the learning and the caring and the sharing. And by respecting each other, then we can all achieve a common goal. That's what we're dealing with,
In terms of cross-cultural communication, I think we're making a big issue out of probably something that doesn't need to be that big. It's about respecting a human being for a human being. I must respect you and treat you the way I would like to be treated myself, and I would like my family to be treated.
The difference from an Aboriginal point of view is that if you don't come with an open heart and an ability to do your medicine in a way that's a relationship mode, they will not ask you for it. So they won't put any complaints up, they will just shut down. Whereas if a Western person feels that they haven't had enough input from you, what they will do is they'll start asking questions. They'll start demanding more of you so that you will give them that relationship that they need to actually feel comfortable with you and your medicine. Whereas an Aboriginal person will retract, and the person that will suffer will be them.
Both sides, people have expectations of what they want to receive, and health practitioners have expectations of what they want to provide. And in that space, there's the two circles come together, there's a common ground, and that's the most effective area where we can work, where those two circles overlap. And that's the area where the best engagement happens and the best knowledge transfer happens, and the key concepts that should be worked in there. All the other stuff is systemic and people bring all their baggage with it. So, yeah, you just work in that space, and it's the most effective way to engage, and you can only do what you can with the time that you've given.
The consideration of different worldviews is something that's very important for medical students, medical officers to understand. People are schooled in a particular way of looking at health, and that may not always be consistent with the people that they're dealing with, particularly Aboriginal people. They will have their own worldviews, they'll already have their own way of looking at health and healthcare practices, and they may not be instantly recognisable to medical students.
My understanding is that people have a very, very close relationship to country, and there's a very spiritual relationship with everything. You know, there's a spiritual explanation for what's happening. There's often a spiritual explanation for why somebody's unwell.
People aren't always equipped to have that discussion. That about they can describe how they're feeling, but when it comes to the systems and advocating on their needs and getting their needs met, it's the expectation may not be as a standard as a non-Indigenous person would expect, in terms of being able to engage and negotiate the level of care that they want to get and the options that are put on the table. A lot of Aboriginal people just take what they're given from the system.
Here it's taken time. I mean, I know people say, oh, we want to have a quick answer and have a rule and have something to follow. Trust is about time. And I could sit with people and listen to their story and respond to how people were communicating, that I learnt, and we've built that trust.
And when you're trying to explain to people who have a lack of medical literacy, and also maybe a lack of English, sometimes imagery is really important. So people seeing what's wrong. So I use the X-rays a lot, so you can actually see where the disease is and point it out to them, and you can then also show them how it's getting better. And I show the patients how it's getting better. It's also a way of making sure that the patients don't lose heart, don't lose faith in what we're doing.
It's not about knowing a lot of information about Aboriginal culture. In the end, it's about just being respectful of other people's viewpoint. If you don't know something, ask them. Aboriginal people love to share their culture. They love us to understand where they're coming from. And that's a universal thing that we need to teach our doctors, is to just sit back and listen and let families and patients direct the conversation more, and be comfortable with silence and listening to silence and watching body language. There's a whole lot of communication skills that's not just about Aboriginal culture and respect. It's about humanity and being better doctors for everybody.